Hey, welcome to Your Personal Health. My name is Jeff Harrison. I'm having trouble finding out there's my camera. Hey, thank you, Dr. Burris and Dr. Kim, for being here. If you just missed the COVID-19 update, you need to go back and check that out. That's from 3 to 3:30 every Wednesday until this craziness ends. And I think, just in case they missed it, are we closer to the finish line than the starting line?
Absolutely. Absolutely. If we were running a marathon, I'd say we were on like mile 23. So we're like close. We're close, but we're not so close that you can sit down yet.
The whole thing, Dr. Michael, is the fact that we have been pent up so much, and it's almost like I think of like watching, if you like watching horse racing, and when you put the horses in the gate, all of a sudden their energy just goes through the roof, and they just can't wait till that gate opens up to run the race. I feel like people are like that. What are you getting?
No, absolutely. I think, there are a lot of competing things going on. And so, we want to be, we want to be respectful for everybody and, the different competing needs. And we feel it ourselves. I mean, Dr. Burst and I talk about, being fatigued as well, and our kids, and we're in this weird phase of both of us are vaccinated, but our kids aren't, and but I think if we all can hold on for just a little bit longer, then the numbers can tolerate more opening and more things going on versus, we just don't want to be where we were last summer, where we were in the same position. I mean, just if you look at the last summer, we were purple to red, and that didn't last very long. So we don't want that again to happen, because then we know what will happen after that. So,
we talk about this phrase herd immunity. Dr. Burst, would you kind of walk us through that and kind of give us an idea? Are we near that herd immunity or herd mentality, or are we a long ways away from it, even if we're just talking about just the Coachella Valley?
So what herd immunity means is that enough of the people in a group in a certain area are immune to a specific disease. So if person A walks out and they're contagious, most of the people they'll interact with are immune and they won't spread it. So when you have enough of the people in your community who are immune to a disease can't take off and cause an epidemic. So that number for how many of the population needs to be immune, either from getting the illness or from vaccination, differs based on the virus. But for COVID, it looks like it's going to be around 60 to 80%. This is a big variation.
Yeah.
And right now, we're probably closer to about 12 to 15% of our population has been vaccinated. And there's probably another 10% of our population that has some natural immunity from getting the disease. So we're really only at about 20 to 25%. We still have a ways to go before we get to that 60 to 80% that we are going to need.
Can you do me a favor? We talk about the COVID, and I want to switch from that because we have another situation that I don't think a lot of people are aware of until they realize it's almost like walking into the pantry and you want to have a cup of coffee and it's 5 o'clock in the morning and you remember that you ran out yesterday. And that's the ability to have a primary care physician. There is a bit of a I don't want to call it a pandemic, but there's a little bit of a disaster there, isn't there? Tell us a little bit about the condition of primary care physicians, which are really the people that we want to depend on to help us stay as healthy as possible. What does that look like here in the U.S. and then here in the Coachella Valley?
Well, most of us that went into primary care, which is usually family practice, internal medicine, pediatrics, the types of doctors that take care of you for your regular problems. Most of us went into this type of medicine because we enjoy people. We like taking care of families. We like having a relationship with people. And what's happened in the United States is that the healthcare system has become so formulaic and so volume focused in order to generate revenue, um, that most of us have either become really discouraged, or sort of like swallowed up by the system, where we're having to see more and more and more patients, and we're not able to give each patient the amount of time that they may need, which causes frustration for everyone. Um, and eventually what happens is that burns primary care doctors out. And so you're having a lot of doctors leaving that field or choosing not to go into it from the beginning because, we talk to each other, and these young doctors coming up are saying, what should I be? And they look out there and I'm like, oh, should I be the doctor that seems to have the worst life and is paid the worst? No. So I think that's been sort of a damper. And so it's caused this situation where we have sort of a shortage of primary care doctors in the United States, which then means the ones that are left have an even bigger burden, more patients trying to take care of more people and being spread thinner and thinner.
Well, Dr. Kim, if you could do us a favor and just share with me the real numbers. I mean, are we talking, are there 5,000 people in the U.S. now being underserved? Are there 10,000 people? What kind of numbers are we talking about here across the U.S. and here in the Coachella Valley that are really being underserved because they are talking to their colleagues that have been out in the field and they're being kind of mentored to say, boy, I wouldn't do that if I were you. If I could go back and do that, I'd be something else in the medical field.
Right. I think we've talked about this before. I think, in ballpark figures, if we're thinking the average physician takes care of 3,000 to 4,000 patients under them. And if we're, in the Coachella Valley, I think 100 primary care providers short, that adds up. I mean, what is that? 300,000 more than that? I don't know. It's a large number. And it's not just they can't find their own primary care doctors. When you do find one, it is hard to get into. Their panels might be closed. Insurances are always changing their rules in terms of what can happen, what can't happen. And then that's not even talking about all the snowbirds that come that are out of the California state. And what options do they have? Because they don't have a provider here in California. It's either the ER or the urgent care.
Yeah, I actually have the numbers. There was a study published last year by the American Association of Medical Colleges that shows that by the end of the next 10 years, the United States is going to be between 21,000 and 55,000 primary care doctors short. So 21,000 is the best scenario, and they predict 55,000 doctors short is the worst. So that's pretty sobering, honestly.
What do they tell us? What do you predict or you foresee that, hey, when that happens, it puts different pressure on other parts of our medical care system? What do you see as the negative part of that?
I think what ends up happening is a lot of people just don't have a primary care doctor, especially people who don't think of themselves as sick. I think what happens is people think they don't need one. And that may be true when you're 22. But as things go on, you start to realize, wait, when something happens, I don't have anybody who knows me at all. Um, or I don't even know how to access the health system because I have no established relationship. Also, often what happens is people get a problem, and at that moment, they try to go establish with a primary and find out that either there's nobody open who's accepting patients, or the waiting time is several months. That's certainly the case here in the Coachella Valley. Um, we've had significant problems getting access to people in a really fast timeline. Um, both the large hospitals are training new doctors and trying to address this problem, but the truth is it's a huge problem, and there's just no way to train enough doctors fast enough to meet that need immediately.
Wow. What do you see? I know that you, Dr. Kim, and Dr. Burris have chosen an alternative route for your practice and to serve patients differently. Can you take a few minutes and tell us about that?
Yeah, so doctors over the last 10 years, primary care doctors have tried to figure out what is a better model that not only helps patients, but keeps their own sanity, because no one wants to work in a job and feel like they have no life, or they just resent their job. That's not a good job. And so, what they've decided and what we've decided to do is build upon a model that almost was like going back to the 1970s and 80s, where you had a relationship with your own doctor, and there was a understanding of what the prices would be. And so we have a monthly membership that's very affordable. And from age 0 to 45, it's $99 a month, and from 46 and above, it's $145 a month. And you get a primary care doctor for that month. There's no extra fees. And with that, we're able to answer the phones. You get one of us. If you call, we can see you same day, next day, if it makes sense. And that last phrase is if it makes sense is important, because we can treat people and take care of them based on really what makes sense for their schedule. And because we're not running 40 people through our clinic, we've seen people after hours, we've seen people on the weekend. And so we don't need to even bring people in for certain things. If it's for something that can be taken care of over the phone or by text, we can do that. And that's only because there's not a third party company in between telling everyone what has to happen. Not that insurance is bad. Insurance has its place. We recommend everyone to have insurance, but with this model, it just affords more personalized access for everyone.
Well, I tell you what, I really appreciate you sharing, the update on COVID, also giving us a real sobering look on, hey, where we are currently with the primary care physicians, and Dr. Burris give us a prediction out in the future. And it's not very bright, but you've chosen to take a different route. So if you find yourself as a patient, someone who is having a hard time getting a doctor, getting an appointment, and you want to look at an alternative, then it's important to take a look at Coachella Valley Direct Primary Care Physicians, and their information is on the screen at 760-642-5549, or you can go to their website, CoachellaValleyDPC.com. And I'll tell you what, as my wife and I are both patients, clients, we have really enjoyed the fact that, it's not like we're calling them all the time, but we know if we picked up the phone that they're going to be there and answer, and it's not going to be one of those things that it's going to be days before we hear back from them, or weeks before we get in to see them. Because let's face it, if you have a flat tire, you need somebody to help you fix it now, not wait somebody says, well, I can get to you in 2 weeks. You need to help now. And there's nothing different than Dr. Burris and Dr. Kim being able to say, come on down right now. That surprised me, quite frankly, the first time Dr. Burris and Dr. Kim said that, but they were absolutely true. We just drove up, they were there ready to take us. So again, Coachella Valley Direct Primary Care Physicians, they're changing the way we stay healthy. Please call them at 760-642-5549, or CoachellaValleyDPC.com. They also do rapid testing for coronavirus. So, you know, Dr. Burris, you said something. I think it was Dr. Burris who said, "Hey, if you're going to go out to eat, you should be tested." And that's a way to get our numbers up. So double down, become a member, and get a rapid test. And then, you know what? Go out to eat. Support those local restaurants. Guys, thank you very much. Any last words before we let you go today?
No, everyone have a great week. I think it's almost summer, so
I think winter is trying to blow out of the desert today. As I've seen small cars, kids. I've seen it's blowing into another time zone. So yeah, be safe out there. And again, thank you guys for all you do and giving us information to stay on top of. Hey, where are we at in the Coachella Valley when it comes to COVID? And give us an alternative for our healthcare that we don't have to depend on being one of 2,000 or 3,000 people in someone's caseload. We can be somebody who we can just pick up the phone and actually talk and see our doctor. So thank you so much.
Thank you, Jeff.
All right. Bye-bye. We'll see you next week.
Bye-bye.